Thank you. And now we will move forward with a presentation from Celia about social media accessible to all audiences.
Yes, thank you. It's hard to follow that presentation of esteemed speakers, but just thank you everyone for being here this afternoon at one of the very last presentations of this conference. I've been learning a lot from all of you, and I hope that I can leave you now with some actionable insights from the social media side of things. So by way of introduction, I am Celia Lear. I currently work at a global health communication agency called Evoke as SVP of Social Strategy. And in my role at on our social team, I also bring a lot of my former experience from HHS into making health literacy a big part of our practice and offering here on our social media team. So that's really what I'm here to share with you today, mainly how to make social media accessible to all audiences and some learnings I've had along the way. So if you want to move to the next slide, thank you, Candace. So what I'll cover during this presentation is some background on social media and how different users interact with it, and some best practices for content development. And for those of you who work in the platforms themselves, I will touch on how you can navigate social accessibility features across popular channels like Facebook, Twitter, Instagram, and LinkedIn. And I think regardless of your involvement with day-to-day social creation or development, I'm also going to share some examples I'm hoping will resonate with you regardless of your job function or role. So on the next slide, first just wanted to share here a quick look at social media usage. That's important, I think, to set the stage for this presentation, especially when we think about our role in disseminating health literate content among the large reach of social channels. So in the US, almost 90% of adults turn to social media for healthcare information, and more than 3/4 of Americans use social to research their health symptoms. And this is happening before people go see their doctor. Social means, it's immediate feedback on responses and maintaining connection. And I think this is really interesting that among Gen Z in particular, 90% of individuals say that they trust medical information shared on social media. And I think that trust is particularly important because as I see it, that means that we have a responsibility to make sure that social content is really easy to understand and to act on. So on the next slide, just thinking about how many people are visiting their social feeds for health information and medical advice, let's look at some of these things that might impact their experience. So according to the CDC, 98 million Americans over the age of 40 have vision and eye problems. And I think it's like 7% of children have a diagnosed eye or vision condition. So we need to really design social media content with this in mind. So what are some ways that blind or low vision users can receive important health content? And the same with users who have trouble hearing. Digital content should be digestible beyond audio formats, and just other things to consider when developing social content. As with all consumer-facing health information that many of us are working on, are things like nuances between how neurotypical and neurodivergent users might interact with content and interpret things, users' mental health, even day-to-day, their physical health, just to make sure that information is inclusive. And that users who might not be as comfortable with technology or familiar with various social channels are also able to obtain the same information. So next slide. Tried to keep this very actionable here. So when developing social copy, just a few things to keep in mind. We do want copy to be in plain language, and active voice. So basically make it easy for any user to read and follow along, and be succinct. So social media best practice is brevity. You just have to imagine, someone scrolling through their feed on their phone like you do. You have limited time to capture someone's attention and to get your point across. So I do encourage you to be pithy and keep things simple. This one, I think we all know, avoid medical jargon or industry buzz. I think this one can be a little bit harder than we might think, especially if we're working in an environment where things need to go through review or might be deemed off message. So as much as you can also try to collect data on how users talk about various diseases or symptoms or areas of research, and start to build a social lexicon to match it, that can become really helpful as well. And write out acronyms. Working in social, I have learned that every 3-letter acronym or hashtag for numerous meetings in different languages around the world have very multiple nuanced meetings or different times a year. So just something to watch out for too. And be mindful of word choice. This means thinking through tone and double meaning, and also avoiding those kind of ableist turns of phrase. For example, instead of good to see you, I might say it's good to be here with you. And just a word about hashtags. I don't know if you guys have heard of camel case, but essentially it's capitalizing the second or third word of a closed compound word. So if you think of brands like PayPal or iPad, you'll see that those are easy to read because of the capitalization there. And this is also really important for screen readers. Actually, if you type in the hashtag Black Lives Matter without the capitalization, a screen reader will read that as Black Lives Matter. So in general, too, it just makes your hashtags more legible and easy to read to an eye that might be quickly looking through social content. Thank you. And the basics of alt text. We hear about alt text a lot in health literacy. Basically what it is HTML code that describes an image on a website or a social channel, and other digital materials too that you're used to, like PowerPoint files, Word documents. On social channels, it's also what's read aloud by screen readers. And not just that, but it's also displayed if load time is slow. So if you think about someone who might be accessing social media from a low connection area, they might be seeing that alt text instead of the image as well. And it's also used by search engines if you want to think about how you can use it for search engine optimization as well. And on the next slide, we have a video just to bring this to life a little bit.
Hi, my name is Megan Roper. I'm a business analyst here at Level Access, and today I'm going to show you how I interact with Twitter on my desktop and on my phone. So I'm going to start by moving over to send out a tweet from the Level Access account.
Tweet complimentary landmark tweet button.
You'll notice that when I use my B button to jump over to any button that's on the page, that it announces what I'm doing. So I'm going to hit the space bar here.
Compose new tweet dialog.
And I'm going to type something.
R-T.
So I just typed up, I'm going to listen back to it.
RT if Megan is your favorite business analyst at Level Access.
RT if Megan is your favorite business analyst at Level Access.
Clickable add emoji. Clickable browse. Clickable add a GIF button, add a GIF.
I'm tabbing to the button to send
Clickable
out
poll
the tweet.
button. Location to save. Add another tweet button. Tweet button.
Space.
Out of list clickable dialog, compose new tweet.
And my tweet has been sent out and is now going to be available on the Level Access Twitter feed. So one of my favorite things to do when I'm on Twitter is to check the trending page to see what people are talking about. But since I personally prefer using the mobile version of Twitter instead of the desktop version for that, I'm going to demonstrate using my phone.
1:11 p.m.
So I'm going to unlock,
Messages.
go into
2
my
social
folder.
Facebook. 1. Twitter.
You'll notice that with the iPhone, I'm using my finger to swipe and VoiceOver is speaking versus a keyboard on a desktop. I'm going to select Twitter here.
Twitter.
I've already got
@Megan_Roper.
my trending page open, and so I'm just going to swipe through here.
Search Twitter. Settings and privacy. Selected. View. Trending. Button.
Trending.
News. Button. Sports. Button.
Let's see.
#Duracell Optimum. Extra. Optimum is here. Promoted by Duracell.
So Duracell is promoting an advertisement.
And we can turn off the video now. Thank you very much. But yeah, if you ever want to just see a screen reader in action, if you're working on a website, or if you worked on a blog post or anything online, and if you use Chrome, but I think a lot of other different browsers have them as well, there is a free screen reader extension that you can just download and install and use it for free, toggle it on and off whenever you just want to hear a web page read out loud by a screen reader and really just get into the shoes of someone who might be experiencing that content a little bit differently than you are. So on the next slide. So when it comes to writing alt text, there are some best practices here just to follow to ensure that ideal user experience with them. So I love this breakdown here on the right. Actually, someone from our team shared this. It's from an advocate who goes by Hell on Wheels on Twitter. And he says that you're not writing a professional newspaper caption of a stock photo. Just let blind and low vision users know what they want to see. Later on in this thread, he actually goes on to make the comparison of a friend being the passenger in a car and his friend is driving. And he's just trying to explain what he's laughing at on his phone or explaining what he's looking at. So that's really stuck with me when I'm trying to write alt text to describe an image. So again, some tips for that. Again, be specific and succinct. You also don't need to start with image of, as that will be duplicative, as you just heard from the video. The screen reader will have already kind of set that up. And also just focus on the main content that you need to get across. So you don't really need to share decorative stuff or design parts of the image. It'll just take up more time when read aloud. And this, I think, is perhaps the most important, is to plug in any copy or information on a creative asset, especially if it contains any new information that's not found in the copy. Like maybe it's save the date information for an event or a definition or various data points. And finally, provide context and tie to the meaning of the post. For instance, I've heard someone describe this to me as an example of a post about smoking policy and why it's important to have different regulations. And it's two kids sitting on a bench outside of school, two students, and there's someone smoking nearby. So they're getting that secondhand smoke. In that image for the alt text, you would want to give that context, not just that someone's smoking, but that there's children, they're outside of school, and just kind of try to really get the substance of what that image and how it ties into the copy of the post. And on the next slide, I've included some posts here for us to look through together. Encourage you to use the chat if you have any thoughts, but in this example on the left, you will see a tweet from the National Park Service, and the copy says, "Tomorrow I'll get up and work out at 6 a.m., followed by me at 9 a.m. So in the chat, how would you describe this image to someone who can't see it? And what might you say beyond just saying that there's a fox in the image too? I think what's really important here is that this is something where the image itself is the punchline of a joke. So we would definitely want to make sure that people who can't see the image don't miss out on it. And we'll want to share that, of course, the fox is sleeping. We might also want to share that this is outside, perhaps in a park, so it makes sense why it came from the NPS. So just another example of how context is really important here, and that sometimes there's something that's being conveyed to reinforce the post, and we want to make that clear. And in this example on the right, as you can see, it says 5 tips to stay healthy at work with a list of different activities. But how can the description be improved here? What information might be missing if someone can't see the graphic itself? So yes, in this image, the alt text says that there are 5 tips, but without elaborating on that, of course, users who rely on alt text aren't seeing what those actual actionable tips are. So if we want to go to the next slide. So I've talked about the copy of a social post and describing corresponding images through alt text, and we'll just shift now to some creative best practices. And a big thing to consider for legibility and ease of reading is color contrast. And there are a lot of free tools out there. There's WebAIM's contrast checker, which I linked to here, that let you test the text or other information that stands out against the background. And this is important for people who may have low vision or be colorblind, or any social media users really logging or going through their feed, and that's often quick moving. You have little time to capture people's attention. Again, you want to make sure that things are really just easy and pop and easy to read. And then much like any other health literate materials, you'll also want to avoid dense blocks of text. And also remember here too, I tell people this a lot, that what you might see on a large desktop monitor is going to look very different on a small mobile device. And so that's why it's really important to test things out. At my agency, we have private test accounts on most social channels, so we can upload and publish social posts in advance and really know how they'll appear and test it across different devices. And in this example here, we have separated some content out into different posts and made it a carousel Instagram post instead of squishing everything into one image. And then finally, just make sure that you tailor content to your audience by featuring people that look like them. If you have a large consumer audience, then diversity should be a critical part of your creative approach. And then getting into on the next slide here, just continuing with some creative best practices, but for video. Just wanted to share some additional tips here, applying all the best practices from the previous slide, but we'll also want to consider that users might experience things like photosensitivity or vertigo. So a general best practice is to avoid flickering lights in any videos or animations. And as you can see in this screenshot here to the left, TikTok actually provides a warning for these types of videos and then gives users the option to skip all photosensitive videos. So with other social channels also really following in that direction, that may also mean that a lot of your content may not be seen by select users who have opted out if you tend to post those types of animations or videos. And your videos should also include captions. And this is important not just for people who have hearing impairments, but for people who might be in an area where they can't listen with sound on, like if you're riding on public transportation or you're in a doctor's waiting room. But regardless of the setting, besides these video forward apps like TikTok, most people actually do still watch videos on social with the sound off. So this is a general best practice for social as well. And then just a final thing to note here is that videos do not have an alt text option. That's for static images only. So that's why it's important to try to voice over videos that include and rely on text and animation to move it along. So users also have a narrator that's taking them through what others are seeing in the video. And this is another thing that kind of has universal appeal, as someone might play a video, but maybe be more of an auditory learner, or they're multitasking and at work and not watching all of the text come up. And so would still be kind of capturing the same information if it's read out loud or narrated. And if we go to the next slide, I'll just transition now before I get into the social channels into built-in accessibility features. And I just wanted to, the light just went out because I haven't moved in the office for a second. But with someone with their own most social media companies have their own kind of centers of excellence. So I did just want to touch on that because I think it's important to note that, companies are taking action, but they're not maybe 100% there in terms of complying with accessibility standards. So again, it really is our responsibility to create content that does, the best job of reaching everyone. But these types of centers of excellence are mainly focused on things like their product offering. So auditing their platform for accessibility barriers and other testing. And then other companies we've talked to have also been charged with recruiting talent that reflects the lived experience of the different user groups that they're designing content for. And then they're also often the bridge between advocacy groups and consulting companies that specialize in accessibility challenges and needs. But as I mentioned, not one social media company out there is fully compliant with universal accessibility guidelines. There are certain roadblocks on each of them that you'll come to find. One example that comes to mind is on LinkedIn. To start an account, if you're on your phone, you're asked to do one of those image CAPTCHA, make sure you're not a robot type of things that is not accessible to someone without sight. They would need assistance or would need to go to their desktop to sign up for LinkedIn. So that's kind of an accessibility to signing up in the first place. And then if we move along here, I'm going to start out with Instagram. And I'm not sure, how many of you are posting to social on behalf of your organization, but hopefully you can kind of glean some insights from these next few slides in understanding available accessibility features on social channels to better advocate for them to be implemented or to try on your own social channels. So starting with Instagram, you can enable automatic video captions to your videos or reels. If you have a video that's already live, you can just go into the 3 little dots down there, and you'll see an option to manage the reel. And from there, you'll see an accessibility section where you can toggle on the show captions option. And where you add alt text is a little bit different across all social channels. On Instagram, this can be found after you've uploaded the image in that final screen before you hit share. So under advanced settings, you will see an accessibility section. And if you click on write alt text, you'll be taken to that empty box to add the alt text, applying the best practices that I went over earlier. And here's where you can find the alt text on Facebook. Again, it is after you upload an image, and there will be an edit paintbrush here. And then you can just go ahead and toggle to where that section is. And just as easily, if you upload a video to Facebook, there is an option to also enable auto-generated captions. So the image on the right here is how that will display. And next is Twitter, everyone's favorite platform these days. So there are also alt text and caption options, but you actually have to enable this functionality first via settings and privacy. So if you go into accessibility in your settings on Twitter, you'll find some options here to turn on the compose image descriptions, but also to turn on some other functions, as you can see here from your own user experience. Like you can also opt to not see as much motion on your feed or different kind of nuances and details like that. So we watched that video earlier of the woman experiencing the Twitter feed. So again, I would just really encourage you to try things like a screen reader extension, just to try things on your own as well. And then on LinkedIn, I guess one nuance with the platform that I did want to call out here is that there is a 300 character limit to alt text on LinkedIn. So just a little bit more than the tweet character limit, if that gives you an idea. And that's more so important to note from, the beginning of creating a graphic, that whatever you create, you have very limited space to describe it to someone who needs that alt text to understand what you're posting. And there's also the auto caption for videos, but we can move along. I know getting up against time as well. So just sharing some final examples here. And I encourage you to use the chat again. I know I'm terrible at multitasking though and reading it too, but you guys can talk amongst yourselves. The first post here is from the crisis text line, and I want to show this because I think it does a really nice job of applying color contrast and breaking up the translated Spanish text from the first image in here, which is in English language. So it doesn't try to squish the translation under an English one. They're kind of standalone graphics done in this nice carousel style. And you'll also see the hashtag Volunteer Appreciation Week has been camel cased nicely so that it's easy to read. And then the middle example from the World Health Organization, I think is nicely captioned and has these short blocks of text to kind of move the content along and keep people's interest. And then the final example of on the right here from the CDC, you can see has alt text indicated by the little indication on the left, and has this nice, simple, I think, but attention-grabbing photo. And then I think you can use a little more active voice maybe in the copy here, but I think it does a nice job of being fairly simple and actionable. So next slide. I just have a few more slides, and as I draw to a close, I did just want to share that personally, I've really had to, check my own privilege as I've talked to many patient advocates over the years who have shared their own experiences navigating social media and digital spaces. And this one quote sums up a lot of what I've heard, which is basically that scrolling social media can result in strong feelings of FOMO and isolation among many people. So I think, again, it's our responsibility to honor that and to do our part to make content accessible to everyone. And next slide. So my charge for you today, regardless of if you're rolling up your sleeves and posting social content or working somewhat tangentially to digital communication, is to do the following 5 things. And that is advocate for the adoption of health literacy in your organization, including social, and work accessibility of digital content into project timelines and plans. And if you do social content calendars, working alt text into those, so it's part of the overall content plan and kind of baked timeline. Collaborating with your creative teams, if you work with creative and design experts, and implementing some of those best practices, and always testing things with your audience. Ask them what's working, and what they'd like to see more of too. And then finally, on this final slide here, I know I covered a lot in this presentation, but wanted to leave you with some really clear steps of things that you can try today. And so that is adding alt text, like I talked about, on one of the social channels that you might use, or baking it into a plan, and using one of those free contrast tools to look at images and run it through and scan for an accessibility score, and adding captions to your videos using a lot of the built-in functionality that social media already has to make this possible. And I will check now the Q&A and try to pause because I can't multitask. I will just say too, knowing we just have a few minutes left, that if you have any questions about social and health literacy, feel free to reach out to me on LinkedIn or my first and last name at evokegroup.com for any questions. There are best practices for word count for alt text. And I think it's around like 100 characters, but basically say the succinct, I can't stress enough. You heard that screen reader, you have limited time, and you just want to make sure that you get your point across in as few words as possible. But I've seen 100 used across different social sources like Social Media Today and Mashable. And illustration of versus illustration or photo. Yeah, that's a really good question. Yes, I think that's fair to say. We've had instances where we've said, a quote surrounded by an animated quote bubble, something that kind of shows the tone of the graphic, because I think that is important. Having a real image versus something that's illustrated, I think captures some of the brand and like stylistic choices of the post, and kind of captures it well. Okay, anti-science, keep you optimistic in the pro-science community will win out over anti-science. Health misinformation, I could do a whole separate presentation on, so let's chat. But yeah, I think part of accessibility, that's definitely part of it for sure, is making sure from a health literacy perspective that we are always trying to be as authentic as possible and really show sources where we can with social channels, knowing we have limited time to do that. Anytime we can link out to real sources, validate things, be as clear as possible. If we have anything backed by science or from medical education or provider, to try to bring their likeness in there and bring some validity to things. That's kind of my quick answer on that, but I know that there's a whole complexity to that as well, but that's a really good comment. Thank you. Okay. Oh, for charts and graphs, yes, it would be similar. I'm looking that I have a minute. It would be similar to like alt text that you would do for Excel or PowerPoint. If you've ever had to do that, it's very complex, but you basically want to make sure that people have an alternate way to get all of that information. So if you need to link out to something that does a better job of capturing all the stats and data and insights that you might be portraying visually in a quick graphic. Really, like, you just always want to make sure that you're providing alternate ways to get the same information. So if you can't say it in the alt text or the accompanying copy, then I encourage you to link out to somewhere where that a PDF can be downloaded, an accessible PDF or something similar. Okay, I think that's it. I don't know if anyone's able to come off mic, if not, but I really appreciate everyone's time and good questions and comments, and thank you all for joining.